All right, so good afternoon. I was just reading about this virus, and it was originally called the Marburg hemorrhagic fever. I think it was like Africa. It was caused by these fruit bats, and it was transmitted to humans because they were working in the caves where the fruit bats were. Can you tell me kind of more about it? What is it? What happens?
So the Marburg virus is actually the causative agent in the Marburg virus disease, obviously. It was first detected in 1967 in Germany, and it's spread by bats through feces or through human-to-human contact with fluids. So it's very similar to Ebola. It's in the filovirus family. So both the Marburg virus and Ebola are very rare, but they have the potential to be very fatal. So with the Marburg virus, the fatality can be up to 88%.
Oh.
So I read that between days 5 and 7, the hemorrhagic symptoms start. So you'll start to see blood and the vomit and the feces coming from the nose, gums, vagina, any orifices. If they get an IV, they can have oozing at the venipuncture sites. And then the severe phase starts with high fevers, CNS involvement, so confusion, aggression, and death can occur at day 8 to 9.
Wow, that's crazy because the incubation period is only 2 to 21 days.
Yep.
Wow. Okay. So I also read, like the incubation period can vary from 2 to 21 days. That's such a huge time frame. But I know that the symptoms they begin abruptly. You get like a super high fever, severe headache, super tired, muscle aches, severe watery diarrhea. Abdominal pain, cramping, nausea, vomiting can begin on the 3rd day.
Wow.
Yeah. So Lisa, where in the world are these diseases most commonly found?
So it's most commonly found in African countries, so Uganda, Angola, Congo, Kenya, South Africa, but also in Europe, like Yugoslavia and Germany, where it all started.
Oh, wow.
So how do we prevent the Marburg virus disease?
I know obviously reducing the risk of the bat to human transmission. The tricky part with that is if that's their only job, they're not going to give that up to try to stop spreading
So if they're
the
working in
disease.
caves or mines as their primary source of income.
They're not going to give that up. But we want to reduce the risk of human-to-human transmission, so educating on sexual transmission, using a form of barrier, getting tested so that if they are, they can kind of control who they're exposing to, which would go with the outbreak containment measures, and just inform the communities that can be affected by the Marburg virus.
Okay. So how exactly do we diagnose Marburg virus?
There's this antibody capture enzyme. The test is actually called ELISA, it's enzyme-linked immunosorbent assay.
Okay.
Then there's the antigen capture detection test, serum neutralization test, reverse transcriptase polymerase chain reaction assay, electron microscopy, and virus isolation by cell culture.
That sounds complicated.
I know. So truthfully, the only way for diagnosis is to have technology that many of these countries don't have. So I know that WHO and CDC are working together to try to figure out ways that they can be detected in a reasonable way that this country can obviously utilize.
Mm-hmm. So how exactly do we treat the Marburg virus?
It's kind of like the flu. You kind of treat the symptoms. So, if they're losing a lot of blood, we're going to have to get them blood. If they're losing a lot of fluids, we're going to have to replace their fluids. But be careful because at the IV sites, if they start bleeding from there, it's not going to work. So, fluids, electrolytes, maintaining oxygen status, make sure their blood pressure is up to par. And just doing like the PTT, PTINRs, making sure their blood clotting factors are there.
Is there an immunization for it?
No, there's no immunization. But then again, it's rare. Just when it occurs, it's pretty deadly.
Okay.
So, what is the role of the WHO and CDC in this virus?
So the World Health Organization and the CDC are always tracking and doing surveillance on, when exactly incidences occur so that they can identify the outbreaks and come into those countries and help to, isolate individuals who have it and treat it to keep it controlled so that it doesn't become an epidemic or a pandemic.
Okay, so like we were talking about earlier with them probably not having the resources necessary to treat it, the WHO's kind of right there to just step in and try to contain it as fast as possible and provide those resources.
A lot of times these countries are developing so they don't have the infrastructure or the governmental resources to manage something like that.